like to thank the Society for giving me the opportunity to give a summary of my Ethicon fellowship. This is the Liverpool Heart and Chest Hospital. The Thoracic Aortic Aneurysm service at the Heart and Chest Hospital performs between 150 to 180 aortic cases per year, and that covers the full range of aortic surgery from root replacement to full thoracoabdominal aortic surgery, and it also includes TEVAR. We have a robust MDT process involving local vascular surgeons and interventional radiologists. We have a weekly aortic clinic and a monthly Marfan clinic. When I joined the team, there were 3 aortic surgeons there, and they have a subspecialist aortic on-call rota as well. Here are my clinical supervisors. The team's led by Mr. Ong U and also comprises Manoj Kuduvali and Mark Field. And my background was that I had completed an MD in cerebral protection in aortic arch surgery with Professor Bonza in Birmingham. I was a West Midlands NTN. I had had considerable exposure to thoracic aortic surgery in Birmingham, and I'd also been lucky enough to do a year out of programme experience with Simon Kendall in Middlesbrough. So when I was appointed to the fellowship, I was independently operating, although I hadn't actually done any major aortic cases. So the priorities for my fellowship were that I would be supernumerary and therefore available for emergency referrals and available to operate at all times, really. The main operative priority was that I would become first operator for as many aortic routes as possible, whilst maintaining my conventional cardiac skills. I would also assist with thoracoabdominal aortic replacements and become familiar with the whole range of perfusion techniques and have some exposure to TAVI and TEVAR as well. So in the 6 months of the Ethicon Fellowship, I performed 35 cases, which included 18 aortic cases, 7 of which I did independently. These included ascending aortic replacements, routes with hemiarch and open distal anastomosis with circulatory arrest, and I did an extent 4 thoracoabdominal aneurysm as well. I also did 17 conventional cardiac cases. In terms of non-operative components, I was responsible for the inpatient management of all the aortic patients. I assessed referrals. I did a 1-in-1 on-call and did assess the emergencies, electives and urgent referrals to the service. I went to the aneurysm clinic on a weekly basis and also took part in the MDT. I did quite a lot of teaching as well in the Heart and Chest Hospital with the theatre staff, the junior medical staff, the SCPs, and also our aortic nurse practitioner that we have as well. I also we have a patient forum and a biannual patient meeting and a patient support group as well. I also analysed the Liverpool results for their type A dissection repairs since subspecialisation of the service. And I was fortunate enough to be able to present that in Houston at the meeting last year where I met Professor Safi. And I also presented it at the SCTS meeting in Manchester and the New York Aortic Symposium. Subsequently, I was very fortunate that the Heart and Chest Hospital extended my fellowship for a further 6 months in order to give me a whole year fellowship. And I was able to complete a total of 40 aortic cases in that time, which included 24 routes, 4 type A dissections, 15 circulatory arrest cases, which included aortic arch replacement, total arch, and I've also done a descending aortic replacement with left heart bypass. I also went to Professor Schaefer's aortic valve repair course, and I was lucky enough to go on a TEVAR course as well. Subsequently, I've been working as a locum consultant in Liverpool since January of this year, and as a lot of people now realise, I was very recently appointed as a substantive aortic 4th surgeon in Liverpool this week. I have lots of people that I'd like to thank. I think, first of all, I'd like to thank the Society and Ethicon for this fantastic opportunity. I'd like to thank everybody in Liverpool, my clinical supervisors and the whole team, really. It's a great place to work and it's a fantastic team. I'd like to thank Professor Pepper, who was my educational supervisor for the fellowship. And Tim Graham, who was great in terms of the administrative minefield in order to get the fellowship approved for training, which we finally did, and so I did have GMC approval for training. And finally, I would just like to say that I wouldn't be here now if it hadn't been for the long-standing support that I received from Professor Robert Bonza in Birmingham. Thank you.